This is Inside Healthcare, brought to you by On Location TV19 and St. John's Hospital in Maplewood. St. John's is your community resource, committed to providing quality care at every stage of life, and is a member of the HealthEast care system. Now here is your host, Jody Ritaka.
Hello and welcome to Inside Healthcare. We're so glad that you could be with us. We're going to begin by talking about National Patient Safety Week, which is March 7th through the 13th, and what it means for you and your family. And joining us in our discussion, we're pleased to have with us and back with us again, Dr. Craig Svensson, the Chief Medical Quality Officer with HealthEast.
Hello.
Glad to have you back with us.
Thank you.
And Catherine Hines, the HealthEast Patient Safety Lead with HealthEast.
Hi.
And another familiar face, Dr. John Kwasniewska, the Medical Director at St. John's Hospital. Thanks for being back with us.
Great to be here.
So maybe we can begin with you, Dr. Svensson, and talk about why do we have this National Patient Safety Week, and what does HealthEast do to ensure the safety of its patients?
Well, you know, many patients will think about general medical quality for the condition that they come to the hospital.
I think they kind of expect it.
They kind of expect it. And what they don't expect, perhaps, is how to be safe or what we're doing about keeping our patients safe while they're with us in the hospital. Hospital being a very complex and difficult place to be and work, so we want to be keeping them safe. What we've done is, we look at a number of national organizations and national initiatives to keep patients safe, things like medication safety, things like labor and delivery, how to keep our patients safe during that kind of event, and also infections, how to prevent patients who come into our hospitals from getting infections from other patients and from the things that we do to help make them well.
So by focusing on this, that helps reduce some of these medical errors and mistakes and things like that? Exactly.
By working nationally, we're able to learn from other organizations around the country. What are they doing? How have they been successful? And what things should we be looking for that we don't even think to look for?
Dr. Kwasniewska, maybe you can tell us specifically what are you doing at St. John's Hospital to keep patients safe?
Sure. As Dr. Svensson mentioned, we have a number of initiatives around patient safety. I'll mention a couple. The first one is around patient falls, preventing patients from falling down and getting injured. Some patients, of course, have limited mobility to begin with, even before they come in the hospital, and they're at risk for tripping and falling. But there are a number of things that happen when patients come into the hospital that can lead them to be at risk for falling. One is just patients are in an unfamiliar environment, and especially when it's dark, if they're moving around the hospital room, that can cause them to fall. They're sick, so they might not be as strong as usual. And also sometimes patients have gotten pain medications or surgery or sedatives that can also lead them to be at risk for falling. So we do an assessment on every patient that comes in to try to identify patients who might be at risk for falling. And we have actually alarms on the beds or on the chairs where those patients are. So if that patient tries to get up without notifying the nurse, we can have the nurse come in and assist them. And every day we identify those patients so caregivers can be more aware. A second initiative that we have is around pressure ulcers. Again, patients who come into the hospital are sick. They might not be moving around in bed as much, and sometimes they can lay and put pressure on one area of the body that can actually cause the tissue to be damaged and can actually break down if that goes on for long enough.
I think we call them bed sores.
Bed sores.
Yeah.
And so again, every day we inspect patients' skin and identify any areas that look like they might be at risk for that, and we can put special padding on those areas or help to move the patient around or even try to improve the patient's nutrition, which can help prevent skin from breaking down and prevent those pressure ulcers.
And as a result of doing the pressure ulcers and also with the fall safety, what are you seeing in the hospital?
We've seen a significant reduction in both of those areas as we put these programs in place, and we compare our rates on both those things to national best practice. And so we're achieving national best practice in both of those areas because of those initiatives that we've put in place.
Challenging, but I'm assuming that you want to have zero results.
Challenging, but very important. We don't want patients to sustain an injury or to have a pressure ulcer We want them to get better, not to have a problem while they're in the hospital.
And Catherine, you're with the Patient Safety Lead. You've got a number of activities planned for Patient Safety Week. Why don't you tell us about those?
We do. So the theme for National Patient Safety Awareness Week is Let's Talk, Healthy Conversations for Safer Healthcare. So we know that in hospitals all over the country, poor communication between patients and their care providers, or even our hospital employees, can lead to medical mistakes. So we work very hard at HealthEast to ensure that we encourage patients to be an active member of their care team. So some of the things that we do are encouraging patients to speak up, especially if they have concerns or questions about their care plan. One of the things that we'll be doing for Patient Safety Awareness Week is handing out small cards for patients as they enter the hospital or some of our clinics with a list of 10 simple questions they can ask their doctor or their nurse if they're with us in the hospital. And those simple questions are things like, when will I get my test results? How many times have you performed this procedure? So those seem very simple, but if a patient is in pain or if they have different medications, those can be difficult questions to remember to ask.
Plus, I would think it would be very reassuring to the patient to get those answers.
Oh, absolutely, absolutely. And a second piece of that on the behalf of HealthEast is that we work very hard with our healthcare providers to make sure that they're talking to one another and sharing key messages about that patient's care plan. So whether it's from nurse to nurse or nurse to doctor, that they're delivering those messages to make sure that everyone's on the same page and in the loop about that patient's care while they're with us.
Sounds like you've got some good ideas and things going on. And maybe the doctors, you could give some advice to our viewers if they're going to be going to the hospital or even just the clinic. What should they be doing to ensure their safety? Why don't we start with you?
Certainly, you know, this let's talk is really important. And the thing that I always encourage patients is to have another person with you. First off, don't be shy about asking questions, but then have that other person there so that there's two sets of ears that are listening to the explanations, that are thinking about the questions, and have a notebook and write the answers down or write your questions down before you come in. So often you'll come in to visit with a doctor and you forget everything you meant to ask. So having that notebook and having someone else present to help you ask questions and hear the answers, very important.
Dr. Krasniewska?
Just a couple other things. Medications, for patients to keep a list of what medications they should be taking. Bring that in when they come to their doctor, or bring that in when they come to the hospital, and really understand what those medications are for, why they're on them, and how they're supposed to be taking them. And if they're not sure, to ask questions. Second thing is for patients who are in the hospital, they all have call lights. So even if patients feel comfortable getting up and getting around, to call the nurse and get assistance when they need to get up to try to prevent those falls.
Yeah, I just had a friend in the hospital, and she was so reluctant to push the button, you know. She didn't want to bother anyone.
Right.
But that's what the nurses are there for, so they want to help, but they need to know that the patient needs help, so that's the purpose of the call light.
Any final comments about patient safety that our viewers should know? Catherine?
Yeah, I would say, you know, one of the things that we stress and focus on at HealthEast is hand hygiene. So if you're a patient in the hospital, make sure that your care providers are washing their hands, as well as your family members and visitors as they enter and exit the hospital.
All right. Well, Dr. Swenson and Catherine Hines and Dr. Krasniewska, thank you all for being with us.